People with severe schizophrenia are liable to exploitation. Sometimes one comes across friends, so-called, who mind their social security benefits for them and cream a lot of them off, and sometimes give them drugs they would be far better off without. Sometimes they'll get beaten up by their friends. One needs to be aware of this. It's very difficult to do anything about it, actually, because they won't complain, and if they did complain, I think they often feel, well, who would believe them anyway? You should look out for this and do what you can about it. Of course, some people with schizophrenia actually do very well. They have an illness, they have it treated. The treatment may well last for a long time, but it goes away and they do not get ill again. Most do pretty well. Sometimes you find that delusions get encapsulated. There was this lady who was a very successful wife, housewife, mother. She brought up her children, she looked after them all, she did all the things which you would expect that she should do, and I think she had a reasonably happy life. And you would never know there was anything wrong with her unless you pressed the right button. And then you would learn that the Archbishop of Canterbury had entered into a conspiracy with her bank manager to defraud her of her money, and she would produce proof, a sort of old battered newspaper photograph which showed the Archbishop of Canterbury, and so on and so forth. In her delusions were encapsulated. She managed not to have them interfere with her life. I believe she even used to go to the bank and draw out money when necessary. She could live a useful, happy life, but she was slightly damaged. Some people have a chronic relapsing course. They keep on having treatment, getting well, relapsing again, usually because they've left off their medication. One really tries to prevent them from relapsing, because being ill is bad for you. And every time somebody gets ill, they're likely just to lose a bit more, to be a bit more blunted, a bit less well, a bit more apathetic, and of course they do a bit more damage to relationships and employment, if ever. So one's struggle is to try to prevent relapse, and it can be very difficult. Some people are severely disabled with schizophrenia, probably no more than 10%. But these are the people who are damaged. They need repeated admissions to hospital, they need sections quite often, and they're likely to need long-acting depot injections. Often the family give up, although sometimes the family actually can be over-caring. One can have the situation where mum does everything, and the person actually ends up chronically deteriorated, blunted, apathetic. All the things which actually used to be ascribed to being in a long-term mental hospital, but which are probably not due to being in a long-term mental hospital, but actually part of the illness. And then, of course, if mum does everything, what happens when mum dies or becomes disabled? They'll need to leave home. They may well need inpatient rehabilitation, and then they will need other accommodation, sheltered housing, supported accommodation, group homes, halfway houses. One needs to have a network which involves carers, community mental health teams, general practitioners, the psychiatric services. They need day centres to go to. Voluntary organisations can often do a great job, actually, because somebody who is a member of a voluntary organisation and befriending the patient can approach them as a friend, as an equal, and they don't have the responsibility for their treatment, but they can encourage them towards normality. So voluntary organisations, if you're lucky enough to have them, ought to be part of this network. They should have workshops, And one is sometimes aware that actually there is a network of patients and they support each other. And of course you can't prescribe this, but you should certainly encourage it if it appears positive, as it usually is. So these are the people who need a network of care. I'm convinced that actually proper care in the community can work, but it is not a cheap option. It requires a lot of resources, and I fear that only too often it has been actually seen as a cheap option, which it shouldn't be. Finally, I think I would ask you to lift your eyes from the 10% of seriously disabled and remember that most people do pretty well. Sometimes if I shop in a particular shop, this lady will tell me that she has been especially commended by the management for her helpfulness to customers. I know that she now has her own flat, which she has redecorated, and she has got back to her sporting activities. Now, I remember 10 years ago, we had a very traumatic removal from the family home under Section 3 of the Mental Health Act. At this time, she was attending university, so she hasn't quite fulfilled that potential. But nevertheless, she is well, she is happy, she is leading a useful life. Intervention makes a difference. Thank you.